Hi there. Thank you for joining us. My name is Christina Bell. I am with Network in Action here in Austin, Texas. And I'm tickled blue because, and we'll explain that in a second. I'm tickled blue today because I have Tiffany Sturman with me from the Williamson County Children's Advocacy Center.
Yes.
And Tiffany, welcome. Thank you for joining me today.
Thank you. Thank you for giving me some time today to chat.
Absolutely. So, first question I have for you is what exactly do you do? I know there's a lot of people that don't understand what the advocacy center does.
It is, and it's a mouthful, isn't it? Too.
It is today.
I have worked here for almost 2 years now, and it is a mouthful to say it. So you're not the only one. No, you're in good company. It is okay. And I love that question. It's just like, what? Come on now, like,
What do you do?
What do we do? What does that mean? And for most people, the great news is if you don't know who we are, it means you have a child who is safe and who has not experienced child abuse, right? And so even though we know that that information is out there, it's a good thing if you don't know who we are. Your children are safe. But for those who have come through our doors, it's really still great to be able to share our message. We really focus on what we call hope, healing, and justice. So we are a full functioning nonprofit, but have a really unique opportunity that we are written into the family code for the state of Texas. And that we really work on a public-private partnership with law enforcement and CPS to work through child abuse investigation cases. So if somebody ever suspects that their child is being abused or someone that they know in their neighborhood and they make that phone call to the report, if that investigation moves forward, those investigators, law enforcement and CPS, they bring their children to our center for that forensic interview. It's our staff who have had hundreds of hours of training to sit in a room and listen to a child to share that experience of what happened to them on the worst day or days of their life. But it's not just that. An advocacy center is really a holistic model. We have forensic nurses on site that are able to provide acute and non-acute, which just means it happened a short amount of time ago or a long time ago, and to be able to do those medical exams on the children right in our center, right down the hallway, not having to travel to a hospital. We have our family advocates who you can think of them as case managers. So they're going to follow a family during their time with us. And we have specially trained trauma therapists to work with the child. And we also have parent therapists because even though the abuse has happened to the child, the trauma has happened to the whole family unit. And it's really important that they heal through that together. Intervention is not enough. And so we also, part of my team goes out and trains youth serving professionals, teachers, daycare workers, educate parents on how to talk to their children about body safety and internet safety, and going out and talking directly to kids so that they also have words to share and understand if somebody's hurting them. So what we do is everything around child abuse is a very holistic manner, from prevention to intervention to healing.
Fantastic. And what a wonderful resource you provide here, right here locally.
Yes, yes. And not every, and it's so important because not every county is guaranteed to have a children's advocacy center. There's still, about 100 counties in the state of Texas that don't have one. Because we are a nonprofit, it takes a community making a commitment to dedicate funds, to bring together resources to get one started, and then to help it fund it and continue its mission.
Okay, that makes sense. So let me ask you this: we're coming off of a year of a pandemic. How has all of that impacted your services, your programs?
Well, I will tell you, COVID has done quite a number on the safety of our kids. So when the stay-at-home orders came out, So children were, closed off into their homes. Well, here's a few data points for everybody to help understand. One, teachers and childcare workers make up anywhere from 20 to 30% of reporters of suspected abuse. So reports dropped by 50%.
Oh,
Coming in for the county. Now, if you just look at those numbers to go, wow, you went from anywhere from 400 to 500 reports in Williamson County a month to like 200. I mean, that's great. No, it didn't mean abuse stopped. It just meant that now it was hidden away from our children's first responders, which are our teachers and childcare workers, right? So one, children aren't being seen. And so all of those nuances and changes in behavior that we train teachers to look out for aren't being seen or exposed. When we look at who the suspected perpetrator was and those cases that were coming in, anywhere, so as an average, 40% of those was a parent that was doing the abuse. So whether that was a biological parent, a step parent, right? So that meant the children were in their home with their perpetrator with no ways or means of leaving or escaping, right? We know that there's enough research that shows us that in times of high family stress, and so I'm going to say a global pandemic is one of those times, right? And people losing their jobs throughout that. In times of high family stress, the severity of child abuse increases. And we were starting to see really around the state of Texas, an increase in child fatalities. Right. I can say because Cook's Children in Tarrant County was very vocal about it. Their child fatality numbers doubled from what it had been previously, right? And so you can look at all of these things surrounding the safety of our children that now we were expecting a big tidal wave of reports to come back in, but because having children back into the school system or back into after school activities has been a bit of a slower drip from the faucet. I don't think any of us back last March and April saw this happening, as long as it did. But now with vaccines, now as people are really starting to enter society, the numbers of reports are hitting up back close to normal. Everything is ramping back up and then some. The good news is that we have remained fully staffed to be able to accommodate those. And so there was nothing that we did that COVID impacted staffing. And so we have our staff here and we've been waiting for that increase. So thankfully we're still here being able to not turn any family away for those interviews or medical.
That's great. It's sad and disturbing, but it's also very encouraging that you're there is that support. So speaking of support, what are your needs right now? What does the center need?
What don't we need?
Right.
One of the, truly, most nonprofits are going to say dollars, right? Because dollars outside of grants that are able to come in unrestricted helps give a nonprofit flexibility and being able to say, oh, okay, well, this department right now, maybe because there's not as many interviews coming in. And so we're able to move some of that money over into this other program. Or right now we're stable with some of these families. We need to be able to direct the money over here because the interviews are ramping back up again. Right. So having those dollar contributions from our community as well, because what happened last year to all of our fundraisers and our events, we didn't get to have them.
Right.
And so we're looking at a year of not as many dollars. We usually get a lot of like holiday party giving. So if a lot of companies, they come together, they do a drive and are able to write a check for us, right? And no companies were having holiday parties anymore, or that company didn't exist anymore, right? And so a lot of the avenues of general contribution that we are used to getting um, have had dried up. So in saying that, what are some of the things that we do for our families to where we would love, besides dollar contributions, are gift cards. So we don't provide direct cash assistance to families. We would not want to complicate the judicial system, and thinking that we were giving something to a family in order to get a disclosure or an outcry or something like that, because that's not what we do, and we don't ever want that to get twisted. But we do know that a lot of families, and because such a high rate of children are being abused by a parent, so oftentimes that means now we're looking at a single parent household coming in for an interview. So we do gift cards for families, HEB, Walmart, Target, right? The cool thing about HEB and Walmart, gas, groceries, and clothing, right? What I call optional necessities that come after the roof, the shelter, and the electricity is paid for. What are those things that they could maybe do without? So we know our families have high demands and needs right now, also because of COVID. So those gift cards that we can go and help provide to families is something that we are always looking for. And then anytime your organization is willing to learn, right? The cool thing about us is that we're a nonprofit that doesn't just ask, but we give back. And what we want to do is share our expertise and knowledge and help bring awareness to your community, help educate parents and kids about what's going on. What does abuse look like? How do we take this from the darkness and stigma into the light? And so that the more that we know, the more that we are looking out for each other's children, and then we get to put ourselves out of business, right? Then we know that we're all coming together, keeping kids safe, and we can go find something else to solve, right? Some other, world thing that we need to be working on. But use us and invite us and learn about us. People think that it's not happening in their neighborhoods, but we know that it is. Abuse does not discriminate. And so I would ask that people please invite us out into their communities, and just listen to what we do and how they can join us through education and training, to help stop kids from coming in our doors.
That's great. Well, is it okay if I share your contact information at the end of this video?
Yes.
That way, if somebody sees this and would like to reach out and help in some way, they can reach out to you directly.
I would love that. Absolutely.
Okay.
Oh, and I remember, because I didn't talk about it. Because I have my pinwheels in the background when you said we were going to reveal it later. And so why is Christina tickled blue?
Blue.
Because April is Child Abuse Awareness and Prevention Month, and blue is the color that represents, right? Every kind of mission has a color that's going to represent them. And blue is the color for child abuse, because one of the ladies who really started this, her grandson had been physically abused. And so it's the color blue to remind people of the blue from the bruises that covered his body, right? And so that's why blue represents child abuse, and pinwheels as a symbol of innocence and the joyfulness of childhood that all kids deserve to have.
That's amazing. So I guess, being tickled blue is not the right expression, but still an important color for this month, an important reminder for everybody, and ways that they can help and be mindful of what's going on.
Yeah.
So Tiffany, thank you so much for taking the time and visiting with me today. And I'm going to share this far and wide, and hopefully we'll have more knowledge out there in the community about what you do, and can get as much support as we can.
Yes, thank you so much for letting me share.
Absolutely. I'll talk to you soon.